Good morning, everyone. Myself Bhagesh Guru. Today I'm going to teach about uh, oral cancer. This comes under the medical surgical subject. Uh, this is very important for the GNM student as well as the BSc students. Okay, let us start the topic. Anyone know about the oral cancer? Okay, oral cancer is also called as a mouth cancer. Okay, what is the proper definition of oral cancer? Anyone? Anyone? Okay. Oral cancer is nothing but abnormal multiplication of cancer cells in the mouth. It can take place in lips or teeth or palate. At anywhere it can take the place. Ah, this is called the proper definition. Oral cancer. I'll repeat once again. Abnormal multiplications of cancerous cells in the mouth is called oral cancer. Okay, what are the main causes of oral cancer? Anyone? It's such easy. First cancer is about smoking. Due to the smoking, oral cancer take place in the mouth. And another one is very important. Tobacco chewing. Chewing gutka and tamba causes the most oral cancer. It especially occurs in the old age people age above 40 plus. For most people chewing the tobacco, it can occur in the mouth. This part of the people mainly suffer from the oral cavity or a oral cancer. It's also called as ulcer. Okay, one example I will show you. This is called the mouth. Okay, this is your teeth. Here the ulcer mainly causes here. Main ulcer causes here due to the chewing of the tobacco. Okay, this is the best example for chewing the tobacco people where ulcer causes. Okay. Next, another example for oral cancer is viral infection or any bacterial infection which causes the oral cancer. And one more is eating artificial food like junk foods like Maggie and especially Chinese food. Especially Chinese food, children will eat outside the town. That is called artificial food. That is not good for health and it causes a oral cancer for it is injurious to you only. Okay, just stop eating that. Okay. These are the main example for oral cancer. Next, sign and symptoms. Okay, what is the first sign and symptoms? Anyone? What is the first sign and symptoms? Okay, I will explain. First sign and symptom is difficulty in swallowing the food. Okay, due to the ulcer, there is a heavy pain in your mouth. You can't chew the food or you can't swallow the food. For example, anyone got an injury to the mouth or anyone got to the injury to the tongue, you can't swallow the food. Due to this ulcer, you have a severe pain in your mouth or a tongue that cannot help you to swallow the food easily. This is the first sign and symptoms of ulcer. Second, pain. Continuous pain occurs to your mouth because of the ulcer. It is damaging very harmfully to you. It causes pain, it causes burning sensation, and burning sensation is also the one of the sign and symptoms of this oral cancer. And another one is bleeding or hemorrhage. Heavy bleeding in the mouth due to the ulcer. It damage to the all surrounding part of the mouth. These are the main signs and symptoms of the oral cancer. Okay. Now let us study about the stages of oral cancer. Okay. There are totally main four stages which in the oral cancer. I will explain first stage of the oral cancer. In first stage, 1 to 2 centimeter, the oral cancer or ulcer starts spreading from one place to another place. Okay, I'll explain in Kannada also. ಒಂದು ಇಲ್ಲ ಎರಡು ಇಂಚ್ಗಿಂತ ಜಾಸ್ತಿ ಹೆಚ್ಚು ಸ್ಪ್ರೆಡ್ ಆಗ್ತೈತೆ ಅದು. ಅದು ಫಸ್ಟ್ ಸ್ಟೇಜ್ನ ಆಗ್ತೈತಿ. ಸೆಕೆಂಡ್ ಸ್ಟೇಜ್ನ ಏನಾಗ್ತೈತೆ ಅಂದರೆ 2 ಸೆಂಟಿಮೀಟ್ರ್ 4 ಸೆಂಟಿಮೀಟ್ರ್ ಬರಬರ್ತಾ ಹೆಚ್ಚಾಗಿ ಹೋಗ್ತೈತಿ. ಇನ್ ಸೆಕೆಂಡ್ ಸ್ಟೇಜ್ ದ ಓರಲ್ ಕ್ಯಾನ್ಸರ್ ಸ್ಪ್ರೆಡ್ ಫ್ರಮ್ 2 centimeter to 4 centimeter. But step by step the cancer starts spreading from one place to another. It increases the spread. Okay. In third stage you are going to see the ulcer is spread to the side part of the tissues and lymph nodes. The lymph nodes and tissues got coming damage, And as well as in 4 stages, you have learned in chemotherapy. At last stage, it starts metastasis take the place. One question rises here: what is metastasis? Okay, metastasis is nothing but spreading of the cancerous tumor or to all the body or all the surrounding parts with damage is called metastasis. At 4 stage, the metastasis take place. Okay, revise once again. In first stage, 1 to 2 centimeter, the ulcer take place, and from second stage, it's take from 2 centimeter to 4 centimeter. It starts spreading. In third part, it starts spreading to the lymph nodes and tissues. It starts damaging. In 4 stages, the metastasis take place and start damaging to the whole part of the surrounding parts. Okay, these are the stages how the ulcer starts spreading. Okay, now next let us learn about the what are the diagnostic evaluation, what are the treatment you are going to do, what are the check you are going to do for next. Okay. Okay, here in diagnostic evaluation, we are going to do general physical examination. Okay, general physical exam, both are you are also general examination from mouth to toe should be done, and in physical examination, 4 types of inspection should be done: inspection, palpation, percussion, and auscultation. These 4 must be done, and PET scan, PET CT scan to be done. Do you know any students what is mean by PET CT scan? Okay, PET CT scan is this is mainly done for the cancerous people. It mainly cost about 20,000 up to 25,000. It costs. That is the rate of the PET scan. This is only done for the cancerous patient. Remember, PET scan is done for the cancerous people. This is the mainly check for cancerous. It costs about 20,000, I think so, in Karnataka. Okay. Next, surgery. Surgery should be done. Okay. And biopsy, tissue biopsy should be also done. This is also one of the diagnostic evaluation. Okay. And endoscopy and CT scan should be also done. Okay. Next, medical management. What are the treatment you are going to give to the oral cancer? Anyone? It's a very easy question. You can think randomly or you can think practically and you can give the answer. Okay, first I will explain you. In cancers, chemotherapy and radiotherapy, these are the main 2 things should be given in the medical management. In chemotherapy, you have to give B fluorocline. This one should be given. And second one, multiparasitide. These should be given B fluorolide and multiparasitide. These both should be done in the chemotherapy, and as usual radiotherapy should be done. Okay, these main 2 are important in medical management. Chemotherapy and radiotherapy should be done for the patient. Okay, now last we learn about the nursing management. It is not nursing management, it is your management. What you are going to give care to the patient as a nurse. It's nothing but giving care to the patient and assist the patient health condition, provide the medication as per doctor prepared. Okay, provide the antibiotics because the infection is mainly spreaded in the, and provide the medication as ordered by the doctor at what doctor has prescribed, and check the input and output chart of the patient. Is there any changes in the urine or any problem in the stool passes, and that should be maintained, and record and report all the documents which are collected by the doctors, and you should be maintain the charts. Okay, these should be done according to the nursing management rules. Okay, this is the main topic that I will explain about the oral cancer. Okay, this is very important for the JNO student as well as the BSc nursing students also. This is repeated for 8 to 7 times in before 10 years question paper. This is very important for the JNM as well as BSc students. Okay, next topic I will come in the next class. Till that, thank you very much.